everyone. Welcome back to Reconstructing Health. This is going to be our episode 1, and I am Matthew. Does everyone want to go around and introduce themselves?
I'm Vicky. Hi, I'm Iram.
Hi, I'm Jasmine.
And I'm June.
And for this week's episode, the main host will be Jasmine and June. So do y'all want to take it over?
Yeah. So today's podcast is essentially a conversation about access to athletic training and sports medicine. And we'll be talking about survey responses from D1 athletes at the University of California, San Diego. And we also had the privilege of interviewing Christian Ahlstrom, a baseball athletic trainer here at UCSD. And he essentially guided us through what athletic training is and why it is beneficial to student athletes. Before we get into our interview, we're just going to introduce some of the topics that we talked to him about for some background.
Yeah, so for the controversy surrounding D1 athletics, the main thing that we discussed is the fact that the D1 athletes are not classified as employees, despite the value that they bring to the schools in the form of ticket sales and other revenue, publicity, that kind of thing. And so there's an ongoing debate, very recent concept of athletes unionizing, so being protected as employees. And yeah.
So just to clarify what D1 athletics is for anyone who may not know, it's essentially the highest tier of collegiate athletics. It goes D1, D2, D3. And then we also talked about sports injuries and how athletic training and sports medicine physicians can help in that sense. Sports injuries are associated with high direct and indirect costs, which can also lead to early sport retirement for up to 24% of collegiate athletes. Collegiate athletes in general also have a 75% chance of sustaining an injury in their 4-year career. When we surveyed our athletes here at UCSD, we found that 7 out of 14 surveyees reported major acute or chronic injury. And this is exactly where athletic trainers come in. So athletic trainers have a role of reducing injury rates and improving recognition and management of various sports-related injuries. Injuries can range from musculoskeletal injuries, such as sprains, strains, breaks, fractures, etc., to chronic injuries and concussions. In addition, we also looked at how secondary schools with ATs are more likely to have emergency action plans, heat illness policies, and they're better equipped at first aid responses such as CPR and AED. And this is also a role that collegiate athletic trainers have as well. And we also talked about the role of athletic trainers in California and the current state of regulations. So a study that was conducted by the Journal of Athletic Training in 2019 actually showed that more than half of California schools reported that they either did not employ an AT or they employed an unqualified health personnel in the role of an athletic trainer. Now, athletic trainers in California are also more likely to be employed at a large-scale public school with fewer students who are eligible for the free and reduced price lunch program. Essentially, it means that athletic trainers are more accessible in schools where students are from a background of higher income families. Disparities in the socioeconomic status were actually seen nationwide in public secondary schools.
So beyond student athletes, this matters to the common American person because about 80% of Americans reported playing at least one form of recreational sport in 2023. And so you can imagine that as people participate in sports, it becomes inevitable that people will get injured. And when people get injured, they need someone to turn to. Like Jasmine said, that's where athletic trainers come in. And again, like she said, we have to think about the people who are underprivileged and don't have access to these resources.
So as we mentioned before, June and I had the privilege of speaking with Christian Ahlstrom, who has been an assistant athletic trainer at the University of California, San Diego since July 2017, and he primarily works with baseball here. He previously spent 2 seasons as the assistant athletic trainer at the University of Massachusetts, Lowell, where he primarily worked with men's soccer and baseball. He attended St. Louis University and earned a bachelor's degree in exercise science before gaining his master's in athletic training. Christian is a member of the National Athletic Trainers Association, as well as the Illinois Athletic Trainers Association. So just to get us started on today's conversation, could you please explain to us what athletic training is and what sports medicine is, and whether there are any distinctions or similarities that we should know about?
So, athletic training in of itself is sports medicine, and I mean, I would say really the two major distinctions between the two are really kind of how I view it as more like, are you dealing with more general medicine type of illnesses versus are you dealing more with orthopedic type of injuries? And that doesn't mean that both, categories can help with either one, but it's really about where kind of their specialties like really fully align. Ultimately, both still have the same goal of making sure that that athlete is receiving the, most up-to-date, best care possible. That the standard of care is not being, breached, and that person is really getting, everything possible needed in order for them to return back to their desired sport. Sports medicine, like I said, dealing kind of with more generalized, generalized illnesses make it sound bad or redundant or less than it actually is. But I kind of, in my mind, I always kind of equate that with sports medicine is really about the overall health of that athlete, while athletic training is more about how do we improve the physical development of that athlete, to put it lightly.
What are steps that individuals have to take in order to become an athletic trainer, and what were the specific steps that you took to come to the position that you are in today?
In order to be an athletic trainer, one of the first things that you have to do is you have to attend what's called a CATI accredited program. So CATI is the organizational body that monitors different collegiate programs, educational programs, to make sure that people are receiving the education needed in order to be an athletic trainer. So I went to school, I entered what's called a pre-professional master's degree. So as I entered, college as a freshman, I was already admitted to the master's program of athletic training. And so from there, I did 3 years of undergrad, which were, your traditional undergrad classes. And then the last 2 years, my fourth and fifth year, were all solely dedicated towards athletic training and sports medicine. So I went through those 5 years. In that 5-year period, too, I also had to accumulate a certain amount of observation hours. It was about, I think, 50 or 60 back when I was doing it. And then when I was actually, for my fourth and fifth year, I would do a clinical experience. So I would take classes in the morning, and then from about noon till essentially the rest of the day, I would be going to an actual athletic training room and working alongside different athletic trainers through there and acting as a mentor, providing aid, educational experience for myself, so that way I can get some hands-on experience before I take what's called our board certification exam. And so that board certification exam is the thing that gives me the certification needed to say that I'm an athletic trainer. So I did that, and you are only eligible to take that after you meet your minimum hours requirements, as well as graduating from a CATI accredited program. So once I graduated my fifth year, that's when I was able to take that exam. Well, I was able to take the exam slightly before it, but then I didn't get my credentials until after I graduated, which was a couple weeks later. After that, I then needed to figure out where I was going to practice and work. And so then I needed to look up the different states' regulations that were out. I then proceeded to at least get a job out in Massachusetts. And so then I had to apply for Massachusetts state licensure for athletic training, which that was its own process. It's more bureaucratic than anything else. Filling out some paperwork. I think I'd take like a 20-question, like multiple choice, like first aid quiz. Felt a little demeaning, but that was what they required. And then pay a fee. And then from there, that's how I received my license in athletic training but that only allowed for the state of Massachusetts. After that, I then, got a job out here in California where there is no state regulations. So I didn't have to worry about it trying to maintain any state licensure. I was able to let my Massachusetts state license kind of lapse. So that way I didn't have to worry about paying those fees. and maintaining that license. And I've started my PhD since, and that's kind of where I've gotten to myself. But really, it's the being a part of a CATIE accredited program and then maintaining or obtaining the amount of clinical hours that I needed to sit for my board of certification exam, and then taking the board of certification exam, and then obviously passing it. Those were the major steps I needed to take.
Could I ask why you decided to become an athletic trainer?
Yeah, very long about winded reason, but the short answer is my mom made me do it. And the I say that in joke because she was one of the people who pushed me into this field. I didn't really know it existed. I was going into my freshman year of high school, and I knew I wanted to play music, but I wasn't really sure what else I wanted to do. And then my mom was friends with our high school athletic trainer, and the high school athletic trainer was talking about how she needed help, and my mom more or less volunteered me to do it. And so, but I started that as a freshman in high school and was able to get integrated with our varsity football team pretty quickly. And at our high school, that was, varsity football was the big sport. And so being integrated right from the get-go and seeing firsthand what athletic trainers and sports medicine practitioners do, I was immediately captivated by it. And it's something that I continued to do throughout my entire time throughout high school. Always, starting in beginning of August when, 2-day practices start and physicals start for our high school athletes, and then working through them all the way to the end of, our state championship finals, and then helping out a bit in the winter as well with our basketball team. So I really got that exposure in high school, and I knew I wanted to do something in the healthcare field, and I knew I was trying to figure it out. And at that time, my sports were a big part of my life, and as they still are with most people too. But I was like, hey, this seems like a fun thing to do, and I was pretty good at it. And basically, when I was then applying for colleges, I learned that I could get a couple different scholarships, and then through there, I was applying to a couple different schools that had athletic training specialties, and that's how I ended up at St. Louis University, which is where I went to my undergrad and graduate program, and gave me a lot of money, and it was a lot of fun. So I was like, why not? Let's check this out for a bit longer. And yeah, I've been doing it ever since.
As you previously mentioned, California doesn't require practicing athletic trainers to be certified. From your experiences, how has this issue affected student athletes and also certified athletic trainers?
I would say overall, from a personal stance, I really have not been impacted by it. I'm for the sole fact that it's I'm not having to worry about maintaining a license or anything like that. However, as a collective of, athletic training as a whole, it's a huge disservice, though, is my opinion on it. And the reason for that is because, in theory, in the state of California, anyone could go around saying that they're an athletic trainer. There's no certification, there's no credentials needed to verify that that person has that type of expertise. So to say that anyone has the same type of knowledge or expertise or skill set needed that I do to help provide coverage and healthcare towards scholar athletes, that's a huge disservice to everyone. It's a huge disservice to our profession, but even more a disservice to the actual scholar athletes, because there's no way that people can be for certain that, does this person actually know what they're doing? And, people are going to get hurt during sports. That's why sports medicine and athletic training exists, and they're always going to get hurt. And sometimes these injuries are, true medical emergencies. And so making sure that we have the right people there who are trained, who have the knowledge needed, so that way if an emergency were to arise, that the proper steps can be taken immediately, so that way we can provide the best care. So overall, it's a huge disservice to the profession and a huge disservice to our scholar athletes across the board by not having any type of state licensure. And so from that, though, most secondary schools and most universities will know that it's an issue, and so they at least require the board certification exam. You need to have that credential, and the only way to get that credential is to meet those requirements that I mentioned earlier. So there are places like that, I would say most places in California operate in that way, but that doesn't mean that every place does. So, yeah, it's a big issue, and it's something that we talk about through our professional organizations as a whole, that every single year they're trying to further push that, state licensure becomes a thing here in California, which I support entirely. Yeah, in the small sense, it may charge me a couple $100 here and there to maintain a license, but in the bigger scheme of things, it's much better for the profession, and it's more importantly much better for the care that's provided to scholar athletes across the board.
Do you think that California's lack of certification in athletic training is due to scope of practice opposition or budgetary concerns?
It's really tough to say because I think it can go either way. From a lot of kind of like the opinions that I hear that go against it, really does come out to be a scope of practice issue, which, that's a whole different can of worms to really dive into. But in reality, what we're talking about is making sure that a specific group of individuals receive the care and attention that they need. And in order to do that, we have to make sure that people are educated, that they have experience in providing those, skill sets to these people. So that way that it just gets refined more and more and more. So that way people really truly get the care that they need and deserve. So it becomes it is a little bit of both, but it's going to be more global than that. Like, it can't be boiled down to just one thing.
How has your personal experience been working with athletes who come from a background of knowledge about athletic trainers and their role versus athletes who've had no prior exposure to this field?
I have had that experience. I've had that experience many times, and I have it usually about every single year with the new batch of athletes that come in. Even from a simple standpoint, like, we get athletes from different countries who, the way that their athletic system is not closely tied with their educational system. So the different types of workers that they have, exposure to is going to be vastly different. And now that, if we're dealing with, a certain affluent level type of athlete, there's this push to, always try to get better, try to get the piece of edge over. So, more and more what I'm actually seeing are athletes coming in who may have had or still have, let's say, private healthcare providers for them, athletic trainers, physical therapists, chiropractors, coaches, anything, really any of them that fall in the gambit, who provide them some type of knowledge or reassurance or direction in which to go. So it's really trying to provide, showcase to them what I am capable of providing, which the big thing I always stress from the get-go is really providing holistic care. And that's, nothing is ever going to be done in an entire vacuum, and that a individual case for one athlete is going to be vastly different from another athlete. So that's kind of how I use, that's the kind of the conversation I take for the group of athletes who may have had exposure to athletic trainers, sports medicine practitioners, or still do when they come to us. And for the side that maybe doesn't, either, a common one that we will get is some of our transfer students, who maybe were attending junior college where, they had access to an athletic trainer, but maybe it was one athletic trainer for, 20 sports. So then you only were able to go to them if there was something really, really wrong, or, if you kind of found a way in. So it's kind of helping bridge them to showcase, hey, we're not here just to keep you out of activity. We're here to actually help supplement your activity so that way you stay out there longer. So that's the message I usually, in the stance I take for that group of scholar athletes who may not have had that exposure, is that my skill set is needed to way better utilized in more of a proactive stance rather than a reactive stance. And the more that I can showcase to them by either bring them into what I'm doing with other athletes, if we're all sitting around the athletic training room and you're working on a couple different things, or by highlighting them, hey, these are some of the needs that I think you have, and these can lead to potential injuries. So let's try to work on this that way that mitigates that chance. That's kind of how I bring them in, and trying to teach them to understand the whys behind why we're doing things, and not, we do this couple band exercises to warm up before every single practice. It's okay, well, yes, why do you do that? Why do you have that certain amount of sets and reps? Why do you need to do this routine, but that person needs to do a different routine? And the more that we can educate that group that may not have had that exposure, just the easier it is to get that buy-in from them. So that way they start to learn what are their needs truly are, or what are their needs truly to be.
So you've spoken at length about this idea of like athletic training not being offered being a disservice to the athletes. Could I ask, like, with the unfortunate truth that a lot of people don't have access to athletic training because of socioeconomic reasons, among other reasons. As an athletic trainer yourself, how do you think that can be rectified? Like, where do you think that change needs to take place?
It's a big question to ask, for sure. And I would say really, for where I'm at in my life and my experiences that have led me to this stage where I've been able to practice, sports medicine and athletic training for almost nearly a decade now, I really think it just comes down to education and funding, the two most simplest terms. Easiest way to think about it, right? Like, you see these institutions that are paying these coaches, absurd amount of money, right? They're having these outrageous contracts that, may last for a year or a couple of years, but they're getting paid outrageous. And the idea is, if we get the right people in, then that's going to lead towards a greater chance of success, right? Which makes sense. However, what's to happen if the athlete, let's say, gets in a car crash and breaks their leg the day before a game, or sprains their ankle or whatever it may be? Like, we need to make sure that the support is there so that way that coach can focus on the task at hand and not trying to juggle more than they can chew, because they don't have that experience or anything. Now, that's not to belittle that their experience in, let's say, a particular, sporting field makes them more advantageous to, prognosis and diagnosis of injuries. I go to my coaches all the time. I'm like, what do you think's going on? Like, you've been playing this game now for 40 years. Like, you've seen a thing or two. What does it look like to you? For when cases are a little bit more gray. But really, it comes down to education and funding, because as long as people know what athletic training and sports medicine can really be, then that's where people can really find the value in it. And that's where more investment into it will come from. And I mean, to kind of circle back to, why would it, and this sounds bad, but it's like, why would anyone try to really fund a profession that's not even recognized by one of the largest states of the United States as a healthcare profession, So which goes back to the reason why we need state licensures to further validate what we are doing and the importance of what we're doing, because the more people find the importance of it, they're going to find more of the value in it. With the most athletic trainers, how you ask them their origin story, like you asked me, a lot of them say, I was an athlete and I got hurt, and I'd spent time in the athletic training. I saw what it got to be. I was kind of in a similar boat, except I wasn't playing. I got to just see it firsthand, what happened. And really, it just comes down to, like, this job of athletic training and sports medicine, and with the pressures that are associated with trying to get the edge on someone or try to be 1% better to, give yourself a better chance at winning games. Like, that takes a lot of time and commitment. And, if someone is not going to fund that and value that, like, why should anyone else then? Like, why should I, as the person who has that skill set, do that? I'm basically been on the road for the past 2 weeks straight, and I'm exhausted. I'm tired. The season's been a grind. I'm missing, valuable time with my loved ones, my personal life. And I don't do this job for the money, because I would argue I don't get paid as much as I probably should, but that's everyone kind of in life. But really comes down to it is that if we are going to find value in what we are doing, we have to have that value internally and then make sure that it's showcased in all of our actions moving forward. So I know it's a long-winded answer to kind of get to that point, but it's simple. Comes down to, education and funding. As long as those two things can be done well, I really think athletic training and sports medicine from a whole can be elevated to a much higher level, and the care and service that's provided to student athletes would greatly improve, allow their physical development to improve, which should improve their athletic abilities, which should improve their quality of life, which then should improve their desire to try to, do more, have more success out there on the field and give them the best chance of victory overall. So it all feeds into each other.
With sports getting more expensive as time goes on, have you seen that impact your profession and like the types of athletes that you see come into your clinic? Or
no, nothing really, not really like that. More so how I've seen it is the understanding of what we can do changes. They understand why we go about a plan in a certain direction. But I would say really the big thing that does it can highlight, maybe where discrepancies are in kind of like our own clinical practice, because even though that you pass the certification exam, that doesn't make you a good athletic trainer. That just means you meet the bare requirements to basically be this profession, which is it's a good thing, but you're going to get better and better every single day that you're out there. And, as long as you have that open mindset with your athletes and kind of hearing about their experiences, allows you to empathize with them better, which then helps build that deeper connection with them. So when, let's say, if I'm trying to create a plan for them, I can come up with the best rehab plan possible to, recover someone from like an ACL tear or ankle sprain, or let's say like Tom John surgery at the elbow. I can come up with the best plan, but if the athlete's not bought into it, it's kind of pointless, because they may think they need one thing versus the other. So by what I'm really seeing more so with kind of more of the funding being pushed into sports and people having access to more things, is that there's a discrepancy between what people think they want versus what they actually need. And that's also a very slippery road to come down. But that's where, by building that relationship and empathizing with the scholar athlete and what their experience is at that moment and what their goals are, like if I can remove essentially my ego out of the mix, then that allows me to make sure that we are both aligned towards the same goals. And if our goals are aligned, the likelihood of us following through and sticking to the plan is going to have a greater chance of success. So that's really kind of more what I see is with all this more investment is really trying to create better relationships with athletes, so that way they can understand really what are the things they need versus the things that they want.
So moving this conversation into the side of scholar athlete experiences, we as a school are currently transitioning into a D1 school. How have you seen this impact scholar athletes mentally and physically? Do you think there's more of an emphasis on winning as opposed to the student now?
Not at all. Never. I have yet, particularly here at UC San Diego, the academics are a huge thing, and people are here for academics. I would say to assume that every single athlete is on scholarship and that they're having full tuition and all that, that's a ridiculous statement. And that's kind of where a lot of kind of the opposition comes from. It's, well, they're already getting their school paid for and all that. It's no, most of them have either some type of degree of a scholarship or tuition reimbursement versus, nothing. So a lot of them are here for academics as well as sport as well. So that's why they're called the scholar athlete, scholar being the first part and the athlete being the second part. So with that, I would say the transition of what it really does, because UC San Diego is the school that it is, like you need to be smart to get in here. That's big criteria. No matter what, like the coaches in the athletic department, they don't have any push or say over, letting a student who may not have as great academic grades as another particular student get in, but just because they're part of a team, allows them to slide in. Like that is so by far not the case here. And I rarely even see that anywhere else at the other institutions that I've worked at either. It may be that the academic requirements are less strict, and that's a different conversation. But really the big thing of what it changes, it's just really the amount of money that's being involved in it, and more from the outside perspective, because if you're trying, the school is already tough enough to get in academically, so that already means that I think as coaches are recruiting athletes to come, they already have to look at a very specific population, and more often than not, universities are more academically challenging, and students want to get a good academic experience. And so that then causes that bit of competition between them, like let's say UC San Diego versus another great academic school like Stanford, right? Like clearly both schools have relatively the same type of academic demands, or it should be somewhat close. But so in theory, both coaches would then be pining for the same athlete, but then it just comes down to, okay, who can give that person more money to convince them to come to that program? That's really kind of the involvement I see more so is trying to say, okay, if we're going to go down this route, really what separates Division 3 athletes, 2 athletes, 1 athletes from one another, it's really money, and it's more outside money than anything else. So that kind of answer that question. I know it's a long-winded answer, and it seems maybe a little contradictory to what I said a bit earlier, but I mean, money is the big thing. It's what's going to attract people. But I mean, think about it. It's the name of the school in itself is half the selling point. I mean, it's San Diego. It's a great academic program. Athletics are really starting to excel here. I get to live for 4 years in San Diego. That's almost a no-brainer for a lot of different people, or for a lot of people. And I mean, that's one of the biggest advantages that the school has to offer,
So you've spoken a lot about the advantages and disadvantages of D1 athletics.
Mm-hmm.
So kind of speaking to that idea of not all athletes are receiving monetary compensation for the value that they produce.
Mm-hmm.
And also to the idea that D1 athletes can be exploited. Do you have an opinion on that?
Are you referring to NIL and
Yeah, and generally, I've seen a lot of people are very against, or it's controversial whether athletes should be considered employees and whether they should be able to unionize or not. Mm-hmm. Do you have an opinion that you can share about that?
My opinion with that is simply, if a group of people are going to provide a service for that an institution or a system benefits from, then it is that system's obligation to make sure that the needs of that group are being met. So, with that being said, when we think about all the different needs and wants that scholar athletes have, and that's really where this whole conversation is at right now in life across the board at every single institution, is what do they need versus what do they want type of thing. And I would say, whether or not they unionize, I believe so. I think that for scholar athletes who are putting, their experience, their time, their investment into a program, and that program is benefiting off of them in some shape, way, and form, then it is that program's obligation to take care of them, whether those needs are academic, financial, versus, living, societal. I think all that needs to be addressed. Now, then it comes down to, who's going to pay for it, right? Which always kind of circles back to the funding. So overall, I do believe that, if athletes have the right to unionize, we all have the right to unionize, to advocate for our own needs and our own wants. And I would say, luckily here at UC San Diego, the administration really does listen to the scholar athletes. That is something that I've seen firsthand, and they actively work towards providing them the experience that they deserve. So, again, it gets a little tricky, at a couple other institutions where, maybe the goal is more monetary than anything else. But here at UC San Diego, that's by far not the case.
What do you think we as normal people who aren't athletic trainers can do to make sure that people have access to athletic training that need it, and people who do have access to athletic training are treated equally, or yeah?
I would say really the best way that people can help, it always comes down to, a bit of education. So the National Athletic Trainers Association, NATA, offers, provide a number of scholarships for athletic training students. So that way that, tuition, textbooks, and all that can be, covered for. So it helps draw the allure towards this profession. I would say if people are willing to give, I would say those would be great scholarships to give. The other bit too would be if you're looking to, try to improve your own physical development in any shape, way, and form, or let's say you're injured and you're worried about, trying to, be back for your rec soccer league or whatever it may be, because injuries are going to happen. Like, go to the people that have the expertise, like look them up, like go through your hospital system, say, hey, is there an athletic trainer that you can refer me to that can help, be a little bit more specific with me than maybe a generalized physical therapist who may not have that much exposure towards athletics. So really it's helping, trying to align your own goals with the goals of an athlete, if that's how it falls. So like if you're dealing with an orthopedic injury and you're trying to come back and be trying to perform at a certain level, then you should go to those people. Athletic trainers are everywhere. They're obviously within our universities and institutions. They're part of our hospital system. They're part of, physical therapy clinics. Like, they are everywhere. And just by even providing, a search and reading about the bios that they have, that's how you can then start to, pick the brains of, okay, does this person seem right for me versus not? A lot of my experience, over the past 10 years has been predominantly upper extremity, which doesn't mean I can't work with anything lower extremity, but that's where a lot of my expertise has come recently. It's really diving into that. It's also been into how to blend both objective and subjective data points to really make calls about athletic readiness. But I'm focusing on such a higher, or I don't want to say higher level of elite athlete, but I mean, the people who I work with are not the weekend warriors. The people I work with, like, I can tell them to do this plan and they will follow it for 6 days straight. And I feel confident that they'll follow it to the T. If a person doesn't think that they have that in them, then they should go to the right person, and I don't want to belittle anyone or anything like that. But really it would come down to providing, like, for what individuals can do, provide funding towards scholarships for athletic training students, or, if you're in need of an orthopedic injury and you're trying to get better, you're trying to return to some level of, athletic performance that you were at before, because movement is medicine. Like, we need every single, physician, every single kind of disease out there. People say, like, yeah, exercise is good for you, and trying to figure out, okay, what type of exercise? Like, that's really where athletic trainers come in. So if people really put in that investment into their own physical health, like, athletic trainers are a great resource for them. So, but it comes down to that person's individual goals, though. So really kind of aligning yourself with that way is kind of how I view that.
I think that's
it.
That's all. Thank you so much.
Questions we have for you today.
No problem.
Thank you so much.
Happy to. It was a pleasure.
Yeah, so now that you guys have heard the interview from Christian Ahlstrom, thank you again to him. We have a survey. So we surveyed 14 D1 athletes, not all of them that go to UCSD, but a significant portion of them, and we have some results to share. We wanted to state that it's important to remember these are not statistically significant, since we only surveyed 14 D1 athletes out of hundreds, thousands. So firstly, in terms of financial motives, so scholarships, sponsorships, and other monetary compensation was a primary reason for pursuing D1 athletics among our surveyees. And most of our surveyees also agreed that athletic training significantly improved their athletic experience.
Another thing that we found out was that most U1 athletes actually experienced improved school life and mental health. And then when we asked them about the question of whether they supported unionization or not, 6 out of 14 supported unionization. 6 out of 14 were neutral. Many of them were citing lack of knowledge in the issue, and then 2 out of 14 actually abstained. So considering what we talked about with Christian through our interview, as well as what we just brought up from the survey results, what are your initial thoughts about this interview, this topic? If anyone would like to get started.
I can go first. As a student athlete, it was really interesting to hear that California has no state licensing for athletic trainers because I don't think my athletic trainer at my high school had any licensing as well. That's why, because it was about 350 student athletes to one athletic trainer, and we were all from different sports. So she was very overwhelmed, and we didn't even know we had an athletic trainer until like 2 years into track and field. So yeah, I thought it was really interesting to hear that there was no licensing because anyone can just be an athletic trainer without any certification, really.
I think even from like a non-student athlete perspective, as someone who currently works and interns in the field of athletic training, it was shocking to me as well, just given how progressive California is with its regulations and protection of like its population. I thought it was really concerning. One thing that I found while I was doing the research for this was that California has the second largest amount of athletes in secondary schools, and I think it's quite astonishing that we don't have regulations in that sense.
Yeah, so I was also a student athlete in high school. I'm pretty sure I didn't have an athletic trainer, and I'm not sure if my coach had any sort of certification either. Yeah, and now since I play a significant amount of recreational sports, like I think upwards of like 8 hours a week, um, I've had my fair share of injuries, and I can definitely speak to how much it impacts me to not have access to like proper healthcare and resources to deal with the injuries. Yeah.
Can I ask, in substitution, what have you been doing when you experienced injuries?
Yeah, so a lot of it is like self-treatment. So like for example, if I sprain an ankle, I know to like elevate it and like for pain management to ice it, take like Tylenol, stay off of it for a little bit, and then progressively strengthen it. Um, but I'm also in somewhat of a unique position where I'm interested in sports medicine. So I've already done some of the prerequisite research to know this information. I think generally students or people in general who play sports won't know this kind of stuff because they aren't exposed to the information like I am. Yeah.
I think it's also important to consider that athletic trainers are not just working in the field of collegiate athletes or schools. They also work in military camps. They work in companies as well. So it's like they provide a wide range of services, which I think are beneficial to a large population as well. So for me, like even though I'm not a student athlete, like I was able to access an athletic trainer because of my injuries as a dancer. And the knowledge that I gained from them was definitely more than I gained from my primary care physician, who wasn't sure how to handle musculoskeletal injuries. So, if anyone has any experiences with athletic trainers, I'm not like, is this your first time hearing about athletic training as a field?
Yeah, for me it was the first time. So like listening to this podcast or like the interview was like really insightful. And just like clarification question, do they do like injury prevention or just like healthcare or like just knowing how to like avoid future injuries in your sport?
So I think that actually it's more of like individual perspective on it and what your athletic trainer wants to focus on. Not every athletic trainer believes injury prevention is possible when you're playing like high impact sports, but they do their best in strengthening your muscles to prevent like recurring injuries. So for example, if you went in with a like an ankle sprain, as June was saying that he's had. They'd probably look at your strength measurements, why you're probably getting your ankle sprains, look at like how much force output that you have in your knees, ankles. They'll look at your hips, see if your body is all aligned, right? So like by strengthening parts that they feel is more on the weaker side, you can help prevent injuries in that sense.
Yeah,
So
I think. Oh, do you
I
want
have
to?
a question. You it's only injured student athletes can take advantage of the services provided by athletic trainers, or anybody?
No, you don't have to be injured to go in. At least in our school, how it works is that if a student is like, "Hey, I'm just a little bit sore. Like, I need some like manual therapy. I need someone to just like give me a quick massage." Like, they can come in right away, and they can also be like, "Hey, I think this is going to be an issue in the future. Can we like get on this right now?"
Yeah, I was gonna say I think Christian put it really well when he said he views his job to, um, like Jasmine said, strengthen the athlete and then make sure, he said, make sure that they can stay out there for longer and play harder for that amount of time. So I think that's a good way to look at what an athletic trainer does. Yeah.
Is there any other parts of the interview that you guys were surprised about, would like to talk more about, need more information about?
I think just coming from like a middle class high school, that if we didn't have athletic trainers, the low income high schools must be like really terrible because they have no injury prevention methods whatsoever. Personally, in my experience, because I had two of my friends tear the meniscus. One of them tore their ACL. One of them had their hamstring like completely snapped during one of the races, and there was no athletic trainer. There was no sports medicine doctor on campus, so it was just horrible. So I can't even imagine for underprivileged high schools that they even have this type of access or knowledge to treatment plans or prevention plans for sports injuries.
And I think the issue there too is like when you don't have access to athletic trainers on the field, and you have like an ACL injury, for example, you're forcing the student to go into the emergency room or like wait until their condition exacerbates and then go into like their primary care physician's office, which means they're paying higher cost for healthcare. Many of them may not even have like the right insurance to cover those costs as well.
Yeah. Oh, sorry. Did were you gonna say something? Yeah. I can kind of speak to that as well. Like as a recreational player, I feel like there's a culture of like, um, we don't really want to spend money on something that we're just having fun doing. And so when someone gets injured, a lot of times I just see them like smack a knee brace on it and call it a day. Uh, there's no real like preventative care or preventative measures that are being taken with recreational players. In fact, I feel like part of the role of an athletic trainer is to get athletes in the weight room and like make them train, get that prerequisite strength for them to play their sport safely. And a lot of people who play recreationally, uh, although you can argue, since their volume is lower, they don't need it as much. But it's still important to take care of yourself and get in the weight room. And I don't see many recreational players doing that.
And then touching base on what you also said about like students from low income like schools not having access to athletic training. I thought the point that Christian brought up in his interview was really interesting when he said that it's not just a factor of budgetary concerns. We also asked him whether it was like due to scope of practice issues. And he said that it's a culmination of everything that's making a difference. But he finds that like from what he's hearing a lot about, it is a scope of practice concern. Essentially, what it means is like for your physical therapist or maybe against your athletic trainers having regulations here because they're afraid they might lose their jobs to athletic trainers in schools.
Christian spoke about something that was, I thought, really interesting. I know a lot of you are interested in healthcare, so I was curious what you guys thought about him kind of talking about his role as an educator, as a healthcare provider. Uh, Yeah.
I think it's really important that as a healthcare provider that you do educate your patients because you might not be having that continuity of care with everyone, but you want to make sure when they walk out of the door, walk out of your clinic, that you're giving them the right information and all the necessary information they have to continue their care on their own. For example, like with athletic training, like you want to make sure that even if a student is not able to come into your clinic every day for rehabilitation for like an ACL or MCL, like um, injury, they're able to do it at home with what they do have. So yeah, if anyone else wants to add anything to that.
Yeah, I think education is really important, but also like the willingness, I think Christian talked about this in interview, the willingness of student athletes to follow the treatment plans, because I know a lot of us, we would not want to follow the treatment plans because we would want to get back into our sport as soon as possible, but then that would lead to more injuries and worse outcomes. So I think just having an athletic trainer that or like PT or sports doctor that the student athlete trusts and puts their guidance in is really important because it is a bond since you're putting essentially your future in them if you are planning to do sports as something professional later on.
Yeah. Iram and Vicky, did you have any thoughts about the education aspect of athletic training as people who aren't interested in pursuing healthcare as a field?
Yeah, I think the patient or whoever is injured knowing the why in their care is really, really important in terms of being more conscious about doing certain movements in the future and also in terms of healing, disciplined healing. That makes sense.
Mm-hmm.
For example, speaking from my experience, when I went to the student health clinic here on campus, every time I have gone, my nurse practitioner, if I was even ever so slightly confused about something, she took the time to tell me everything that I needed to know about it. And she gave me resources as well. She wrote it down, the websites and everything that I could also further my education in my own time as well. And it made me care more about the um, whatever the situation was, the topic was. And also, if I'm educated, I can educate other people as well. So there's more knowledge that is spread.
Vicky, did you have any thoughts that you wanted to share about any of the interview aspects?
I agree with like the importance of education and just like spreading awareness of what athletic trainers do, like Christian said. I think that's what he said his main initiative would be for like sorry, I'm looking through the interview notes.
While you collect your thoughts on what you want to share, maybe we can shift into unionization and what your thoughts are on that. Like, is this the first time you're hearing about it? Do you think that athletes should be able to unionize? And yeah, if anyone wants to put anything out there.
I think we've been talking, my team was talking about this because we have a lot of football players that transfer to my high school in order to get into D1 football, such as Berkeley or UCLA. And then they were talking about they were really happy when I think they passed a law so student athletes can actually profit off of their names and get brand deals. So that was a really important thing because they can actually start making money off their name instead of colleges exploiting them. But I've never heard of unionizing before. I don't think they've ever talked about that, so it's completely brand new to me. But I am interested to see how students, like student athlete unions, would work since everyone is on a different basis for student athletes, like in college, especially with scholarships, housing, etc., etc.
I think one of the surveyees mentioned being in support of unions in the context of funding for different sports. So I think they mentioned that different sports get different degrees of funding, and having a sort of baseline funding amount would be really helpful. And it seemed like they were implying that unionization might help with that. So does anybody have any thoughts about that?
It's really interesting because I think in a large scale too, the funding that you get as a team probably depends on how much funds you're bringing into the school and what sports that the school defines as their like top sports. For example, if you're going to college with a football team, most of their funds are probably going into their football team and may not go into a sport as much as like rowing, for example. So I think that baseline is necessary so that students do have access to like, because like I think the money that they get doesn't just like pay for their uniforms, for their training facility, for their coaches. It also pays for like their funds for like MRIs and healthcare, as well as like their dietary needs and nutrition as well.
Yeah, and then I think Christian and Matthew, you also touched on this, the sponsorship. So with the legalization of sponsorships for NCAA athletes, I think one of the main arguments against unionization is the fact that a lot of student athletes seem to be receiving monetary compensation in the form of scholarships or sponsorships. If you guys are in support of unions, how would you refute that? Or if you agree with that statement, why do you agree with it?
Well, I think yes, like a lot of students are receiving scholarships, but not everyone is, and not everyone has played for a full 4 years. They've only played for half of their time at a D1 school. And I think, as Christian also said, that the understanding that like everyone has a full scholarship, everyone has access to like what the other player has is not the right ideology when you're considering all that. So I think unionization will kind of help protect the students who don't have that full scholarship.
I think unionization will also help students that have injuries that they have to stop playing for a year because a lot of people are scared of losing their scholarships and funding and brand deals. So I think that would help protect and make sure they have financial security even if something goes wrong. So they actually do follow their treatment plans from their athletic trainers and sports doctors to rest and heal and take the stress off because, as Christian said, they are student athletes. So they need to put academics first instead of athletics.
Okay, I think we can conclude today's discussion and episode. Thank you so much for listening. If June, you want to give a brief recap of like what we discussed today?
Yeah, so today we discussed D1 athletics and the current discourse that's happening around unionization of D1 athletes and the ongoing discourse around the exploitation of them, as well as the importance of athletic training, access to athletic training, and why that matters for a common person.
Yeah, so we just wanted to thank everyone who was able to be part of our discussion. I think we got some really insightful thoughts here. And we also wanted to shout out Christian for allowing us to interview him and bug him about questions. We really, really appreciate it. And then stay tuned for next week's episode, which is going to be about substance use, HIV, and harm reduction.